Good afternoon, everyone, and thank you so much for joining us for our second webinar in our Summer Wellness series. For those of you who do not know me, my name is Gina Campanella. I am the principal attorney of Campanella Law Office, and we, in pertinent part, provide general counsel and legal services to businesses, small businesses, entrepreneurs, and physicians and providers in solo and small practice. And in part and parcel of that, I really wanted to bring something of value to my clients this summer to encourage them to really focus on their own health and their own well-being, just as much as they focus on their business that they are passionate about. So today, without further ado, I'm very excited to welcome Jari Becker from Town & Country Compounding Pharmacy, who's going to talk to us a little bit about women's wellness and the idea of compounding pharmacy supplements, things of that nature. But I will let Jari introduce herself and start with the topic of the day. Jari, please.
Thank you, Gina. Hi, everybody. My name is Jari, as Gina had said. I've been a pharmacist for about the last 30 years. I first started off in retail pharmacy, which would be your CVS, Walgreens, mom and pop pharmacies. And most recently in the last 2 years, transferred over to a compounding pharmacy, which is a whole different walk of life. So with that being said, I'm going to give you a view of my agenda for today, which we're first going to go over what a compounding pharmacy is, because it seems to be something that most people are unfamiliar with. And then, of course, women's health issues, nutritional vitamins and supplements that can help you with those health issues. And then touch upon hormonal changes and symptoms and options, because there are many supplements and vitamins that can help with those issues as well. So to start off, what is a compounding pharmacy? A compounding pharmacy is a pharmacy where we make medications from scratch, basically. We use raw materials to produce products that are unavailable in your retail pharmacy. So your Walgreens, your CVS, your mom and pop pharmacy. And the reasons we do that is because they are either unavailable in those pharmacies in dosage forms that don't exist, or maybe a manufacturer has either discontinued a product or it might be on a shortage. For instance, semaglutide, which is known as Ozempic or Wegovy for weight loss, is the biggest one going around now that is on manufacturer back order, something that we compound. We also compound for babies and children. So for instance, if they needed a blood pressure medication, which only comes in a tablet or a capsule, we'll put it into a liquid form. We do end-of-life care for patients who are on hospice and no longer able to take medications by mouth. We'll make them either topical or rectal medications. We do for surgery centers medications that they'll need prior to doing surgeries. Can't forget our pets. They're very important to us. So we'll put our medications either into very small capsules or into liquids. We do a lot of eye drops. Unfortunately, eye drops for pediatric patients are in doses that are too high. So we do that. We do a lot of pain pumps and low dose naltrexone for autoimmune diseases or pain conditions. Those are our most common. There are many others that we do touch upon as well, but just to give you an idea. And we touch upon all these women's health conditions that you'll see listed on this slide. I am not going to go over all of them, but some of them that people don't realize. Women can have a painful vaginal condition called vulvodynia. We can make a topical cream that they can use, and that particular condition can be very uncomfortable for a woman to even be able to sit. Hemorrhoids, which are a recurring issue, not necessarily for pregnant women, but for women all around. This lovely little blue rocket that you see in the center of the screen allows the medication to stay for a period of time to help shrink the hemorrhoid. Breastfeeding women have nipple infections that make it very painful for them to be able to breastfeed. And then to go along with women's health issues, recurrent vaginal issues such as vaginosis, yeast infections, UTIs, that's all conditions that we can provide medications for. These list some particulars for both men and women. I was told we have a few women visiting us today, and thank you so much for joining us. But we touch upon all sorts of different conditions, and you can get a glimpse here on this slide. So to move on to women's health, we have supplements that we actually have a front end in our pharmacy where we do sell vitamins and supplements. So people do come in and they will get vitamins and supplements to go along with their prescriptions, sometimes instead of their prescriptions. Sometimes they use a general retail pharmacy and just visit us for vitamins and supplements. The vitamins and supplements that we carry are considered medical grade. So they're typically professional brands such as Zymogen, Orthomolecular, Pure Encapsulations. And medical grade means that they're high quality supplements that are distinguished by strict safety standards that the manufacturers employ. They have good faith practices. They test the products. They are very transparent about the products that they use. And most of these products are free of a lot of allergens. So you'll find that they're soy-free, dairy-free, gluten-free. A lot of them are vegan, which is helpful for a large population of our patients. So to start off with some women's health issues, these are just general supplements that are good for anybody. But when we talk about women's health, we should probably start with the most important, which is diet, exercise, nutrition. They, of course, affect how we feel and how we look. There are also different topics depending on who you are that are sometimes hard to stomach. Nobody wants to change their diet or add a little exercise or give up their candy or their cakes or their sweets. So we say to use it in moderation. A small amount of exercise, if you can get your steps in every day, if you can trade in that piece of candy for a piece of fruit, that's always good for your nutrition. Give up those carbs and add a few more vegetables, etc. But these vitamins and supplements that I have listed here are some of the more common that we do sell on any daily basis. And some people use them in conjunction with one another. Some people use them separately. At Town and Country Compounding, we are a pharmacy of 8 pharmacists any given day, which you will find 4 to 6 of us there. And most of us take up to 30 different capsules a day. And I know that's a lot. Don't expect all people to be able to do that, but we have access to it and the knowledge to be able to use those vitamins and supplements. But a lot of people tend to focus on one portion of their body or their health that they'd like to maintain at any period of time. And we say definitely go along with that. There's no need to think that you need to take as many as we do, but of course you do. I'm here at any given time to help you so that you can choose the ones that are best for you. Listed on the slide, I have vitamin K and D, very good for using along with our calcium. What they do is they help with the absorption of our calcium, but also the building of bone. Vitamin K tends to be one that most people tend to eliminate when they're using calcium. Very important to add it to it. Orthobiotic is a probiotic. We tend to gear patients more towards a multi-strain probiotic of more billion units. What that does is that helps to maintain our entire body, not necessarily focus on just one portion of our body. And for women specifically, we do also have a brand that focuses on women's health. There's actually a separate strain in there for the vaginal area to make sure to decrease in yeast infections, UTIs, etc. But multi-strain probiotics are very good for making sure that our gut stays healthy, and our gut happens to be the main portion of our body that is responsible for making sure if we are healthy or we are sick. The Women's Pure Pack is an individual pack, or I should say a box of individual packs of vitamins and supplements. It actually contains your vitamin D and K, omegas, which are good for our heart, zeaxanthin, which is good for our eyes. It also includes adaptogens, which are great for stress and anxiety, and I'll go over adaptogens a little bit further. New Adapt, actually listed on this slide, is an adaptogen itself. And I should probably say that as I go through all these different vitamins and supplements, you'll find some of them repeat on multiple slides, because they do have more than one use, so that you do get multi-use function out of taking something. Primary concern of most women as we get older, especially, is aging and wrinkles. Our skin loses the collagen that it has and our elasticity. So there's different options to help with that. Regenemax is a capsule that helps with collagen loss. So if you are if you're looking for something to help your body produce more collagen, Regenemax is a capsule that is very good for you. If you prefer to use something other than a capsule and put a scoopful into your shake or coffee, we have collagen peptide powders, which are a great option. We also have listed here DHEA. DHEA is a hormone within our body, but it has also been known to help with improving our well-being, our cognitive function, our body composition. Excuse me a moment. DHEA for women is dosed anywhere from 5 to 25 milligrams. It's something that you can purchase over the counter. We typically start women off at 5 milligrams. Hyalife is hyaluronic acid. I'm sure you've heard a lot about that. You find it a lot in different cosmetic products. But what happens is our skin loses its moisture as we age. Basically, the outer layer of our skin begins to separate, so water evaporates from our skin much easier. There's also moisture loss that happens as we get older. So Hyalife is a capsule product that you can take. We call it the product that helps to moisturize our body from the inside out. We have patients that use it for wrinkles, dry skin. It helps with dry eyes. It helps with dry joints for ease to make movement much easier. It also helps with vaginal dryness. So it's sort of an all-in-one supplement that anybody can use. Nitric oxide. Nitric oxide is great for cardiovascular, brain, and sexual health. What it does is it helps to increase our blood flow. Our nitric oxide levels are within our body decrease as we get older. So we lose 50% of our nitric oxide by the time we are 40. We lose 85% of it by the time we are 60. And if you happen to be a patient with any one of the conditions that are listed on this slide, such as type 2 diabetes, autoimmune disorders, metabolic conditions, obesity, your nitric oxide levels are already at a lower level. We also have different factors within our environment that decrease our nitric oxide within our bodies. Our diet is great for being devoid of essential nutrients. We are a nation that does not eat a lot of green leafy vegetables, such as your kale, cabbage, lettuce, etc. We're a society that is not very big on exercise, although that's slowly turning around. And then, of course, medications that you take, antibiotics, antidepressants, NSAIDs, birth control, proton pump inhibitors, which would be something like a Nexium or a Prilosec. And then pollution in our environment all help to decrease our nitric oxide. The funny thing is about nitric oxide, or I guess the kind of cool thing about it is there's actually an American scientist who won the Nobel Peace Award for discovering that nitric oxide levels decrease and that we do need to supplement for it. So here this slide shows that nitric oxide ensures sufficient blood flow to different areas of our body, and it actually does increase blood flow to the genital area. So it'll support female arousal, it'll support genital engorgement, lubrication. We've actually had a patient who has come into the pharmacy, male patient, but he was using Viagra and he was claiming that it wasn't working. So he had started to take some nitric oxide to help increase the genital area, because of course it's not just specific to women. And he also found out that it helped to decrease his blood pressure. So he was able to get off of his blood pressure medication. So nitric oxide has other functions as well. It helps to maintain our blood pressure, sustain cognitive function, and of course helps with hormone production. If anybody is interested at any point in time in finding out what your nitric oxide levels are, there is a quick little saliva test that we have in the pharmacy, no cost to you. You can just stop in if you're a local person, take one of these little test strips, and it'll show you what your levels are if you're actually interested in finding out. Everyday health problems occur from stress. Who here doesn't have stress? We all have stress. And what basically happens is when we are stressed, our cortisol levels increase. Cortisol levels increase, when they do increase, they cause issues such as inflammation and weaken our immune system. Anything that would increase our stress levels are also going to help, or I should say not help, our sleep issues, causes weight gain, anxiety, mood disturbances, causes hormone issues, which is very important and kind of circles back around to those anxiety, mood disturbances, weight gain, and sleep disturbances. And as I said, it also weakens our immune function. So a lot more colds, COVID, flu, mono, and that basically happens a lot in college kids and high stress jobs. And again, who doesn't have a high stress job these days? In addition to causing stress on the body, I also want to mention that high cortisol can also be due to things such as getting a vaccination or being in an area where there's increased mold and you have a mold allergy, being outside where the air level is really poor and it's causing a stress on your body, not getting enough sleep at night. Some people think that, 5-6 hours, I can run on that, but that actually causes issues on your body overall, where it increases your cortisol levels. So just some ideas. These are different issues or consequences of elevated cortisol. Weight gain, low energy, night sweats, memory issues, increase your blood pressure, increase cholesterol, triglycerides, blood sugar, increased risk of osteoporosis, inflammation on our body. So cortisol is just one of about 50 different hormones within our body. So when I speak about hormones later on, it kind of circles back to cortisol and different issues that you can have related to the cortisol. If you're interested in finding out what your cortisol levels are, there is a saliva test that can be done. This unfortunately does have a cost that goes along with it, but what it does is it will measure your 4-point cortisol, and it does it by saliva versus a blood test that you can do in the doctor's office, which would only measure your 1-point cortisol. And I like to say that our cortisol chart resembles a ski slope. You start off at the top, and which is the morning, because our bodies are stressed as we're waking up in the morning. We're taking it from that nice relaxed state, and then it drops as the day goes on. So think of your ski slope. A lot of people who have increased stress in their life, either they don't have that typical ski slope, or they have an elevation back in the evening time. Some people are flatlined the entire day. So it's very important to have an idea of where your cortisol levels are. And your cortisol levels, unfortunately, affect other things in your body, as I had said. So taking certain adaptogens can help with your cortisol levels. And here I have listed some different adrenal support, because cortisol is produced by our adrenal glands, which are located down above our kidneys. And basically, adaptogens are a combination of herbal supplements that enable our bodies to manage our stress and restore balance after a stressful situation. I should probably also backtrack that cortisol is your fight or flight mechanism. So when you are thinking about those stressful situations and you're starting to panic for them, your body then increases your cortisol, or if your body is not producing enough cortisol, it'll start to steal your other hormones in your body to make more cortisol so that you can react to that stressful situation. So these different substances or products that are on this page, such as the New Adapt Adrenavive Adrenal Essence, those are different types of adaptogens. So as I had said, they're herbal supplements. Most herbal supplements consist of the 3 main ones, which are ashwagandha, eleuthero, and rhodiola. We do also have some additional adaptogens in there, which are other herbs. Some of them help manage your stress a little bit better. Some help with sleep. Some help with mental clarity. Some help with memory focus. So if you are having any of those specific issues, I can help you at any time gear towards an adaptogen that would be better towards the symptoms that you're experiencing. Relax Max is a powder product, where the others are a capsule. Copacom is actually a liquid where you can take a couple of drops, and Copacom is actually known to relax your body without causing drowsiness. Very big seller for us. So as I had said, when your body does not have enough cortisol to react to a stressful situation, it then turns around and steals your hormones, your sex hormones. So that would be your progesterone, your estrogen, your testosterone. And as you'll see on this slide, this just gives you some different symptoms of hormone imbalance. So if you're a stressed person and your hormones are being stolen, you can see an increase in weight gain, sleep disturbances, night sweats, hot flashes, low libido, vaginal dryness, foggy thinking, memory issues, anxiety. Those are some of the general complaints that I get. And these symptoms can start as early as 10 years prior to menopause. Women can see them as they're still menstruating, and we have different options to help with those. But I just want to give a brief review for people who are not familiar or not educated enough on the different hormonal phases of life. So there's premenopause, which you're having your monthly periods on a consistent basis. Perimenopause, which can occur anywhere from 8 to 10 years prior to menopause. Completely erratic, does not necessarily have to do with your cortisol, just has to do with your body in general, and usually occurs anywhere from your early to mid 40s. Once you no longer have 12 consecutive periods, you're considered in menopause. It's the end of female production. Your ovaries are producing very little estrogen, and it typically occurs somewhere in the 50s, age 50s. So in perimenopause, because your hormones are so erratic, we typically would recommend an over-the-counter supplement, and there are ones that are specifically geared towards perimenopausal symptoms. There is a huge misconception that when you are in perimenopause that you need additional estrogen. Even though our levels are declining, your estrogen levels are still usually at a high. They're just not balanced with your progesterone. So typically we'll recommend that women take a progesterone supplement, which is actually prescription. You can get it both at your retail pharmacy. You can also get it at a compounding pharmacy. The difference being what's available at the compounding pharmacy is not a peanut base, and it's also slow released so that it can help you sleep and level off your hormone levels a little easier. Not sure if many of you had seen, but back in, I believe it was February, the New York Times had posted an entire article on menopause. This is kind of a funny blurb, or a very realistic blurb, I should say, of the symptoms that women experience when they are in perimenopause leading to menopause. And I'm just going to read it for those of you that didn't see the article. It stated the symptoms were varied and intrusive. Some lost hours of sleep every night, disruptions that chipped away at their mood, their energy, the vast resources of goodwill that takes to parent and to partner. One friend endured week-long stretches of such heavy menstrual bleeding that she had to miss work. Another friend was plagued by as many as 10 hot flashes a day. A third was so troubled by her flights of anger. Another felt a pervasive dryness in her skin, nails, throat, and eyes, as if she were slowly calcifying. And basically, I'm here to say that nobody should have to experience any part of that. As I had said, we do have supplements as well as prescription products that can help women. We do have both topical estrogens and oral progesterones. Progesterone can actually be used topically as well. Vaginal estrogen to help with the vaginal dryness, and topical testosterone to help, it does help somewhat with libido, but when testosterone does do other things as well, it is responsible for our weight gain, as well as our binge eating. So this is just a graph to show you how our estrogen levels decrease as we get older. That would be the red coloring, and you'll see by the time of age 80, it's just pretty much the level that would fill our feet. Some symptoms that go along with menopause, I had stated earlier: hot flashes, night sweats, vaginal dryness, anxiety, mood swings. Back pain is a big one. Urinary tract infections. Sometimes women don't realize that increased urinary tract infections have to do with menopause itself. Urinary leakage, sore breasts, frequent urination, hair loss, weight gain, of course, big complaint. Memory lapse is another one. This slide here just shows how it breaks down to the different portions of our body, so that it's not just focused in our groin area. It has everything to do with from our head down to our toes. For those women that are lucky enough not to experience any hot flashes or night sweats, hot flashes are a rapid, exaggerated heat that occurs in your body, where the sweating typically occurs in your face, neck, and chest. It has to do with our neurotransmitters. So what we do is we would then recommend some menopausal support. So particular products that I have here, Femquil, Femorin, and we do have another one in the pharmacy, Menafem. And I should probably preface with these slides just focus on some of the products that we carry, not all, but those are all herbal supplements, kind of like the adaptogens, but these particularly focus on the menopausal symptoms, night sweats, hot flashes that you may be experiencing, insomnia. So those do help to level off those symptoms that you're experiencing. We also have listed on here Bone Maximizer. I had spoken earlier about a calcium supplement. So Bone Maximizer is a one that promotes bone health and bone density. As I mentioned earlier, our bone density decreases as we get older, leads to osteoporosis. I also have on here Apicurb. Apicurb is one to help decrease your appetite, hence the name Apicurb. We also do have a new one that we just brought in called High Phenolic, which again is a bunch of herbal supplements that will help to curb your appetite. The rep actually came to visit us yesterday, happens to be moving quite well. Product also listed on here is called Uberlube. If you're not interested in using any supplement that has herbal ingredients, Uberlube is just a moisturizer. It can be used vaginally. It can be used prior to sexual intercourse. It's also used by people who are runners to help with any chafing when your clothing touches your body. It's a very interesting product. Comes in a nice little bottle, so if you're keeping it on your nightstand, it doesn't look so terrible sitting there. A product for all women to consider is Estrodim. Estrodim is a product that helps to make sure that our estrogen levels in our body are eliminated properly. As estrogen is broken down in our body, it goes down this very long pathway and breaks down into different substances. Some of them that are healthy substances, some of them are non-healthy substances, and those non-healthy substances are the ones that can lead to different types of cancer. So any woman should consider taking Estrodim to help to make sure that their estrogen is being eliminated properly. I have melatonin on here, which can be used for our sleep. Melatonin helps with our circadian rhythm. So we have different reasons that we have insomnia or are suffering from insomnia. And I should probably preface that insomnia is classified as your trouble falling asleep. It's also trouble staying asleep. And it can also be from waking in the middle of the night. A lot of times that can happen from your night sweats or hot flashes. Sometimes it's our brain is just racing. So we have anxiety and worry. Some patients wake due to pain conditions. So for those, as I started to say, we have melatonin. Melatonin helps to regulate our circadian rhythm. So comes in doses as low as 1 milligram. I've seen doses as high as 10 milligrams. It's been said that melatonin should not be used consistently every day, that you should always take a melatonin break of 2 to 3 days somewhere in your cycle. So depending upon how long that you're using it would depend on how often you take a break. I had mentioned New Adapt previously, which again is one of our adaptogens. Adaptogens help to regulate our cortisol. By regulating our cortisol, you are therefore helping your sleep cycle. Magnesium glycinate. I'm sure you've heard of taking magnesium before. There are many different types of magnesium. Magnesium citrate, magnesium oxide, magnesium threonate, glycinate. So all sorts of different kinds, but depending upon which salt component you have with your magnesium depends upon what it will help you with. Magnesium glycinate is the form of magnesium that is very good for helping you to fall asleep. Good sleep hygiene is also important to make sure that you are consistent with the time that you go to sleep, that you are in a darkened room. Sometimes doing mild exercise will help your body to come in a relaxed state to be able to sleep. Of course, decreasing your caffeine and making sure that you're not having any large meals prior to sleeping is always helpful. We have the supplements that are for anxiety and mood. Again, issues that happen with menopause also happens for women who are not in menopause. L-theanine is one of my favorites. I call it the natural Xanax. What its point is to relax your body, help you deal with some stressful situations much better. Magnesium glycinate is here again. I should probably also mention that magnesium glycinate is probably the most easily absorbed substance or salt of magnesium for your body. So as I said, it was listed for insomnia. It's also helpful for anxiety and stress. We also have the Clopicon that I had mentioned earlier, 5-HTP to help with those anxious moods, stressful situations. And then we do also sell and Imbue brand of CBD oil. CBD oil is a great option, which is, of course, regulated to the point that has less than 0.3% of THC. But I always mention to use some caution depending upon if you are drug tested at work. Some tests are more specific in being able to detect the THC than others. So menopause, it helps, I should say, it decreases our memory, focus, attention, and recall. I'm sure people who are in that situation can relate to these statements here that I feel like I'm losing my mind, or I start a sentence and I can't remember the next words, or I'm always losing my phone and you're complaining about it, yet your phone's in your hand, or in my situation, where are my glasses? They're on my face. Sometimes you just can't remember basic things. Sometimes you lose the ability to spell. A big one happens to be you feel like you're getting Alzheimer's. It's been said that the use of estrogen supplementation can actually help patients who have a history or a genetic precursor to Alzheimer's disease. So supplements that can help with your memory and brain. Again, I have listed our adaptogens, which would be the new Adapt, your nitric oxide that we had discussed earlier. There's your omegas, which would be the Monopure, the Pro Omega, which are your fish oils. So they promote your healthy mental function. They also help with cardiovascular disease, your nervous system, and joint health. I do have on here, I'm sorry, Brain Sustain, which supports brain health and a healthy memory. And Memorol, which is actually a combination of vitamins and herbs to help support your cognitive function and your brain tissue. So I had mentioned earlier that the product Ozempic and Wegovy are on manufacturer back order. So it is an option for those patients that are looking for help in weight loss. And as I had said, we do compound semaglutide. It is human grade product. So it is not, does not go along with the rumors that people are concerned of it being research grade or animal grade. It is human grade, and our product is actually sent out for testing so that we can assure that it is a quality product that you're receiving. For patients who may be using it, we have different supplements to help support your weight loss. Mitocor is a vitamin minerals supplement that helps to balance your liver function. Our liver is the portion of our body that is responsible for our fat metabolism and helping us lose weight. Prior to, if you haven't already or have thought of starting any one of the injectable medications for weight loss, you can always use something like Core Restore to help clean up our liver and to enhance the results that we would experience or expect to experience with using the injectable products. While you're using injectable products, Hepatocor happens to be a great product. It helps protect our liver function. It helps to optimize it. It helps to improve fat metabolism. And then, as I had mentioned earlier, high phenolic, which is a product to help curb our cravings and appetite, to help you support a healthy weight, which can be used whether or not you are using any injectable product. There are other products that we do have to help with weight management. There's Leptin Manager, which helps to decrease your appetite and help to break down the fat. Apicor, Relora, Inflammacor, a powder supplement that you can put inside your drinks. Fit Food Lean is also another one. But all of these help with our fat metabolism, help to decrease our appetite, and to make us feel full before we would even consider taking that next bite of food. So different ways that we can help with your hormones to help with some of the symptoms that you may or may not be experiencing. Some people just want to know what their hormones levels are as they may be approaching menopause. Some people are experiencing different symptoms. We do sell a saliva test. The saliva test then enables, what happens is you basically spit into 4 different test tubes. You stick it in a self-addressed sealed envelope. send it out to the lab results come back to me. I then give you a call to set up a 15-minute consultation at no charge, where we discuss the different hormone levels that you're at, the different vitamins and supplements that you can use to help support symptoms that you're having, or your hormone levels in general, or you can fill out a questionnaire that we have on our website to set up a time to discuss hormone levels and different vitamins and supplements. A picture of our saliva test. Once again, it is the same test that can be used to test your cortisol levels. The same test actually has 5, I believe, different profiles is what they call it. So you can test your hormones alone. You can test your hormones with a morning cortisol, your hormones with a morning and evening cortisol, your hormones with all your cortisol. You can just do cortisol alone. If you're interested in getting some more information regarding bioidentical hormone replacement therapy, there is a QR code here. You can also go to our website. So a lot of times people don't know where to go for symptom management and overall wellness. You can turn to practitioners such as Dr. Lisa Campanello-Capo, who spoke last month. She is a functional medicine physician. They are more apt to help with vitamins and supplements and bioidentical hormone replacement therapy. You can also reach out to Town and Country Compounding, one of our many pharmacists, or me. We also have a list of physicians who we work with on a regular basis that we can recommend to you. Consider making some lifestyle changes, whether it be your diet, exercise, or your sleep habits. You can consider using many of the supplements that I mentioned previously. And there's always the option of hormone therapy. And I'd also like to invite those of you that are local. We do have a Women Wellness and Wine event that we host monthly, which we go more in depth to hormone therapy and different options, as well as the specific supplements that you can use to help with those symptoms. So just to circle around back to a compound pharmacy and why we do what we do. We are an accredited pharmacy, so we are in the top 1% of compounding pharmacies in the entire nation. What that means is that we are licensed by an outside agency that verifies that our pharmacy staff has a level of training, expertise, and competency to perform patient care services, not just necessarily slap a label on a prescription for you, to help your physicians with clinical case management. They also ensure that our facility meets the cleanliness standards as well as our equipment is up to par. So all of our pharmacists there are able to help with any type of therapy that you're looking for that you cannot find in your regular pharmacy, or if you're just stumped and looking for some direction, as well as the vitamins and supplements that I mentioned previously. With that being said, I invite all of you to subscribe to our newsletter. We have a blog that goes out monthly, which gives information on different health topics. And you can unsubscribe from it at any time if you find that it's too much information. But there are some health and wellness tips. There's basic medication education, and we do put promotions on there sometimes. And that's all I have for you for today. Here's my information at Town and Country Compounding. You can call or text at any time. You can come visit us in our storefront. You can send us an email, and I look forward to meeting many of you.
Thank you so much, Jari. That was a wonderful presentation, so much information. I had a couple of questions, but you actually answered them for me. So
awesome.
during the presentation. So thank you so much for all of that. And thank you for everybody who joined us today. Anybody who was registered today will be getting a link to the recording of this presentation. So if you know somebody who registered but was unable to join us at the last minute, please let them know to rest assured they will be getting the recording. I will also be sending information on how to register for our next presentation, which is going to be on Thursday, August 17th. And for that presentation, we're going to have Dina Siegel, who is a doctor of psychology, joining us to talk about the practice of self-care. What is it and why does it work? So I'm very excited to continue the Summer Wellness series. Thank you again, everyone, for joining us. Thank you, Jari, so much for everything today. And I hope you all have a good afternoon.
Thanks again.